Hi doctors, welcome to the new episode of our A to Z series, Season 2, where in each episode alphabetically we discuss one of the most repeated previous year topics of INI-CET, NEET PG and FMGE. And our today's episode is episode B, where B stands for Bartholin abscess. So let's begin our today's discussion with solving this MCQ. A woman comes with complaints of pain and swelling in the perineal area. She also has complaints of difficulty in walking and sitting. She gives a history of multiple sexual partners. On examination, a tender swelling is seen with redness on the labia as shown in the image given above. What is the most likely diagnosis? Option A, chlamydial infection. Option B, Bartholin abscess. Option C, genital tuberculosis. Or option D, herpes infection. So which option is correct according to you? Well, yes, option B, Bartholin abscess is the correct option. So now let's discuss all we need to know about Bartholin abscess. Let's begin with discussing the key features of Bartholin gland. Where is Bartholin gland located? It is located posterolaterally in relation to the vaginal orifice. What is the position of Bartholin's gland? It is situated deep to the bulbospongiosus muscle. It is superficial to the outer layer of the triangular ligament. Moreover, it is embedded within the erectile tissue of the vestibular bulb at its posterior extremity. Bartholin gland is normally impalpable when it is healthy, but it is palpable when enlarged due to inflammation. The vascular bed of the gland causes brisk bleeding during removal. Now let's discuss about the duct of the gland. It passes forward and in inward direction. It opens externally to the hymen on the inner side of labia minora. So now let's move ahead and talk about the size of Bartholin gland. It is approximately 10 mm in diameter. And where it is located? Bartholin gland is located near the junction of middle and posterior thirds of the labia majora. Now let's move ahead and talk about the key features of the duct length. The duct length is about 25 mm, capable of expressing a thin mucus secretion under pressure. The infection of the Bartholin's gland and its duct can occur in acute gonorrhea with the reddened mouth of the duct distinguishable on the inner surface of the labium minora. Now let's talk about the functions of this gland. It includes secretion of lubricating mucus during sexual intercourse. The labia majora merge imperceptibly into the perineum at the posterior commissure. Moving ahead, now let's talk about the key features of Bartholin's cyst. Bartholin's gland is also known as greater vestibular gland. The cyst is located at anterior 2/3 and posterior 1/3 junction of vulva. Bartholin's gland functions to keep vagina moist during intercourse. The epithelium of the gland is columnar, whereas the epithelium of the duct is stratified squamous, and the epithelium of the terminal part of the duct is transitional. Now let's move ahead and talk about Bartholin's abscess. The blocked duct can have mixed aerobic or anaerobic infections. The most common reason for infection is Staph aureus. This condition is extremely very painful, and the treatment is marsupialization under general anesthesia. Here we incise and invert the edges, exteriorization of the cavity. Prefer do not excise Bartholin's gland or cyst. So that's all for today. Thanks for watching and see you in my next episode, which will be episode C. And yes, if you have still not subscribed to my channel, please do subscribe it. Till then, bye. Take care.